My name is Charles Alessi. I'm Chief Clinical Officer at HIMSS, and I'm here today in Brisbane, Australia for Asia Pac. And with me, I've got my old friend,
colleague,
my young old friend, colleague and partner in crime, because we've done a lot of work together, Professor Snowdon from the University of Windsor.
Yes.
And the rest, so, because there's more than the University of Windsor.
Right.
But we're here today really for this conference where Anne is presenting a paper around value chain, and really let's translate that into something perhaps which is more relevant to people, even though value chain per se is relevant to people, of course, which is everything from safety and clinical efficacy. So start talking to me about how you see value chain affecting health and care systems.
The first thing to say is calling it a value chain, a supply chain, a whatever chain has been one of our challenges. But let me tell you what's underneath and what the intent is so that we can have a discussion, because I think that's what's so important. Healthcare is one of the largest sectors in the world. It is continually challenged on delivering its mandate to help populations achieve health and wellness and quality of life, no question. We are also in a very interesting time in healthcare where complexity is growing. We have science and technology coming at us as clinicians, I'm a nurse by training, or even as patients, families, members, in terms of how do we help our loved ones receive the care we want to. The question becomes, have we really given our clinicians, families, patients, populations the tools to enable and inform the work they do, the decisions they make around what's best for them, the outcomes they wish to achieve? And can we do it in a way where our clinicians, families, and patients as partners in care can thrive? So all that to say, value chain is perhaps one of the closest, because it's, do we have the technologies, the infrastructure in place so that I as a nurse can track and trace which patients are receiving what kinds of care, what products are being used in care, who is delivering that care, under what conditions, and does it achieve the outcomes that that family patient wants to achieve?
Yep.
And those clinicians feel are the best outcomes that could be achieved. That is the actual focus.
So let's put this into context.
Yes.
And let's contextualize it in terms of what this means for an individual. So could you give me one example of how, you mentioned track and trace, so let's pick on that.
Right.
How having a very well-developed system can actually make a difference to the life of somebody, because let's talk about people's lives, because that's important.
So let me paint a bit of a scenario for you. A adult has terrible arthritis in their hip, and they've been referred to from their clinic, general practitioner, to an orthopedic surgeon for a question: should we replace that hip? Now imagine the clinical setting where that orthopedic surgeon and that family member has access to global data that says hip implants for women of a certain age and fitness level and health level and social employment work they do, the best product that is possibly available across all countries based on everything we know today, real world evidence. Here's your best opportunity in terms of what implant, what type of surgical procedure, what outcomes can we expect, and what risks do we have to actually mitigate. Having that automated integrated flow of data into the discussion between that surgeon and that patient and their family is what I am looking to achieve. Because until we know what's happening in terms of outcomes in the real world, what's the best opportunity, best care, best timing of that care, best products, in which types of care environments achieve the very best outcomes and for whom. That's what I'm looking for.
Okay, so let's say we lived in a world pre-value chain.
Yes.
And
like
compare
today.
it to a world post-value chain.
Right.
I'm getting to an age where one day I may need a hip replacement.
Yeah, me too.
So, what difference is it going to make to my treatment? I want to contextualize it in the context of an individual. What does it mean for the person?
What it means for the person is complete and comprehensive access to what's working best for whom, under what conditions, and what can I expect. And what are some of the outcomes that nobody can always anticipate but do happen?
In other words,
proactively decide
In-
what's our best option.
In other words, the likelihood is I will have a procedure which is more suited to me.
Yes.
I will have an outcome which is better than I have today.
Right.
And should there be a recall of the device which is implanted, they would even know where it was and who has it.
Here's another example, which for a family inpatient. Let's think about youth mental health. There are a whole a range of drugs that we use to help people overcome and manage anxiety, depression. There's genomic data today that's emerging that suggests certain populations, depending on where your history and legacy is genetically, are able to metabolize those drugs better than others.
Yep.
Imagine the discussion where you're working with your provider on how best to help my son or daughter with their anxiety, depression, and right to the genomic level, they can tell me that they have a 92% chance of having benefit from this drug because we know that based on the real world evidence of value that's currently available somewhere in a data set, but now flows right into those discussions between clinicians and families.
So I can reframe that in my mind into a process whereby this is the mechanism for the deployment of precision medicine.
Yes, it is.
And deploying
Yes.
what we call precision medicine, which in essence it is, but the way we're doing it at the moment may not be ever so precise, is usually through some bespoke route because we haven't got a comprehensive process.
And precision medicine at the moment is a little bit more towards that lab bench science,
Yes.
which is critical in terms of what is the precise treatment for a particular illness.
It's going to go everywhere.
What we need to
Yes.
get it to is how does that knowledge then get extended to when you live in Nunavut in Canada, or Oregon in the US, or Northern England? How do the real world evidence help us understand what it will actually achieve for you?
Yes.
And that's personalization in my perspective.
Yes. Finally, we probably should touch upon something which we've been developing at HIMSS, which is HSIM.
Yes.
And HSIM is a maturity model to assist organizations on this journey, which is an absolutely essential and fundamental journey.
Yep.
Could you just describe it in essence?
So HSIM is simply a tool. When we work with, as researchers, we work with health system leaders, clinician teams in a number of countries, and lead a global network actually in this very space called Scan Health. Constantly these organizations and leaders are saying, Anne, I see it. I see the opportunity and the importance. How do I get there? So think of the GPS roadmap that helps guide you where the turns, where the technologies are needed, when and how they're implemented, what those actually achieve, where the clinical teams then start to achieve value, and in addition, what's the return on investment? If I implement such a tracking traceability system based on global standards, what will I see as health system leaders? Because they have to account for that. Building into that model helps you identify. You will see inventory savings of 30% at this very early point. You will see opportunities to streamline your work environments at this point because clinicians now have tools they didn't have before. So that return on investment and the pathways to where do I start, where am I starting from, and where do I need to get to achieve that fully enabled, personalized tracking and traceability across an entire system.
So if there's a time for this to be deployed, in a world of diminishing returns and increasing activity, and increasing complexity. This is
Yes.
one.
Yeah.
So, thank you very much for the
My
opportunity
pleasure.
to have a
It's
conversation.
absolutely my pleasure to have a conversation today.
I found this enlightening. I mean, this introduction to this
Yeah.
world is something which I think we need to talk more of.
And many systems have done this.
Yes.
And as consumers and citizens, we're very used to having these systems in place and having that information
Yeah.
right in the palm of our hand. This is simply the
Yeah.
opportunity to
Health
accelerate
is
that
catching up.
in healthcare.
Yeah.
Yes. So that's where we're at.
So thank you very much.
My pleasure,
and
Charles.
Enjoy
Thank you
the
for
rest
the
of your
opportunity.
conference.
Thank you so much.
Thank you.
Bye now.